So welcome to the Navigating Desmoid Tumors Education and Support webinar. I'm Brandi Benson from the Sarcoma Alliance, a nonprofit that supports individuals affected by sarcoma, a rare cancer. We offer resources, support groups, and advocacy, including our Assistant Fund program aimed at improving patient and family outcomes. Our event today is sponsored by Springwork Therapeutics, with whom we formed a strategic alliance with. Together, we aim to shed light on desmoid tumors during our sessions today, and we hope to leave you all with more answers than questions. This webinar will be recorded and accessible via the Sarcoma Alliance platforms, specifically the YouTube channel, ensuring an ongoing availability to those seeking to deepen their understanding and foster a community in this rare cancer landscape. Next slide, please. Thank you for that. Here we have our agenda for today. It's focused on raising awareness and education for healthcare professionals, patients, and caregivers about desmoid tumors. We'll start with covering the best practices and treatment options, and then with our patient journey and perspective. This format that we're using today is a very informal conversational flow with participants asking questions throughout. So if you have any questions or comments or concerns about anything, please do drop them inside of the chat, and we have allocated a specific amount of time to address those questions during that time. Next slide, please. So what are desmoid tumors? Joining us today to provide that insight and a comprehensive understanding of the disease from a medical standpoint is our amazing KOL expert, Dr. Kasper, who will share some educational insights. Next slide, please. All right. Hello, Dr. Kasper, and thank you for joining us today. Before we jump in, we do want to give you a quick moment to introduce yourself, who you are, your impact on the desmoid tumor community space, and what you've done so far. So we would love to hear a little bit about you before we jump into our discussion.
Yeah, thank you very much, Brandi, for the kind invitation, and thanks for joining this event today. Yeah, my name is Bernd Kasper. I'm a medical oncologist by training, based in Mannheim, University of Heidelberg in Germany, and I'm actually dealing with patients with sarcomas, GIST, and desmoid since more than 10-15 years. And in the desmoid field, I have been the principal investigator of the DeFi trial, so the trial with nirogacestat in progressing desmoid tumor patients, which at the end eventually led to the approval of nirogacestat for this disease, which is actually the first approval for this disease indication ever.
Oh, wow. That's amazing. Thank you for sharing that. That's really awesome. So we have a couple of questions to kind of jumpstart this. Our first question is, what are the typical clinical presentations and symptoms of desmoid tumor, and how do they differ from other tumors or conditions?
Yeah, first of all, maybe before we start, I think it's important to mention that we are really talking about a very rare disease here. So we are speaking about 4 or 5 cases per 1 million of the population per year. So desmoid tumors are locally aggressive, invasive soft tissue tumors, and they are actually quite challenging for us to treat because they have a very variable presentation and often unpredictable disease course, and until most recently, a lack of approved therapies. So in principle, desmoid tumors can occur at every site of the body, but of course there are sites where they are more often and less often. So abdominal wall, lower extremities, for example, are the most common sites. And clinically, they usually start growing as a painless or minimally painful mass. They often grow as a single lesion and then can result in tissue or organ infiltration. But, and this is important to mention, they do not metastasize. And that characterizes them in comparison to other malignant tumors. But clinically, of course, they can lead to chronic pain, to functional deficits, to disfiguration, psychological problems, decreased quality of life for the patients, and in very rare cases even to death.
Wow, that is, I didn't know that about it. I know that it sometimes, or it doesn't metastasize, so that's really interesting to know, like, the kind of the totality of this type of tumor. So my next question is, what is the current understanding of the causes of this? What's the risk factor associated with this? Is there any like genetic predispositions to consider? Like, why does this happen? Do we know that?
Yes, we have a bit of knowledge about that, and important to mention that we differentiate two types of desmoid tumors. So 90 to 95% of desmoid tumors are sporadic, so they just come up by chance, more or less. And these desmoid tumors are characterized by a very specific gene mutation, which we call the CTNNB1 mutation. And to really, let's say, foster or to really ensure the diagnosis, it is quite important to perform this mutation analysis and find this mutation. The other 5 to 10% of desmoid tumors arise in the context of another disease, which we call FAP, which stands for familial adenomatous polyposis, which is actually a hereditary disease and is associated with colorectal cancer and can also be associated with desmoids. But this is, of course, the rarer indication, and they are characterized by another mutation, which we call an APC mutation. So the mutation analysis in the diagnosis helps us to really find out if patients belong to the one or the other group.
Okay, well, this then leads like perfectly into the next question. What are the recommended diagnostic methods and like imaging techniques for accurately identifying these two different types of desmoid tumors? I didn't know there was two types. I thought it was just one specific type. So this is really informative for me specifically. So how do you diagnose them, and what type of techniques do you use to do this?
Yeah, I mean, clinically, they both can occur as very similar, and so they usually grow as a lump or as a tumor. And what we initially do is imaging. This is very important. Do not just cut it out. Imaging is very important as the first step, and the recommended imaging method here is MRI. You can also do a computer tomography, but MRI is the preferred option here. And then when there is a suspicion of a desmoid tumor, the next step should be doing a biopsy. So gaining some histological material where you can really do a proper evaluation of the histology. And with this biopsy, you can also perform the mutation analysis, which helps you really to secure the diagnosis. So these should be the steps.
Okay, and this is kind of off topic a little bit. So is desmoid tumor, is it cancer or is it just a tumor? Like what's really the difference? Because sometimes I feel like I've heard that it's like a cancer, then I've heard desmoid tumor patients, they say, no, it's not a cancer, it's just like an aggressive tumor. What is that about?
So the proper definition is actually it's a tumor. It's not per se a cancer, but because it lacks characteristics that other malignant tumors have, such as so that they metastasize. So there is a definition which we call intermediate, or the WHO classification puts them into a category which is called the intermediate category, which means that they, on the one hand, can grow locally aggressive, but they do not metastasize. So they are somewhere in between, but it's not correct to say that they are benign, but it's also not correct to say that are malignant.
Got it. So it's like their own little category. It's like a The
Yeah.
gray. In the gray. That must be really hard to have to go through. Okay. And then my next question is, can you provide an overview of the available treatment options for desmoid, both of the different types, surgical, medical, radiation therapies, like what's most appropriate for each and why?
Yeah, sure. And there has actually been a lot of change over the last, let's say, 10, 15, 20 years. So let's say 20 years ago, patients with desmoid tumors were treated as other malignant soft tissue tumors or soft tissue sarcomas, so with complete resection. And then at some point, we found out that it is not really necessary to cut it out at the very beginning. So the mainstay or the initial approach for the majority of the patients, meanwhile, is what we call is active surveillance. That means we just watch and wait and do MRIs, controls, imaging controls, and the idea behind is to find out to which category the desmoid tumor really belongs, because there are desmoid tumors which stay quite stable, or we even have spontaneous regressions in up to 20-25% of the cases. But the other, let's say 40%, really show an aggressive growth and dynamic growth. And with the help of this active surveillance, we really try to find out to which group the patients belong to. And this is something we do at the very beginning when we have the initial diagnosis. And when there's really an indication for treatment, that means when we have a subsequent tumor growth and there is pain, symptoms, whatever, problems, really decrease in quality of life of the patient, and then we have a different treatment armamentarium. Surgery doesn't play such a major role anymore as it used to be. So surgery is only indicated when we have complications, for example, for mesenteric desmoid tumors, when there are complications, bleeding, perforation, or things like that. Then we treat the complication, and when we have when we have a progression on active surveillance or a progression on medical therapy, then we also sometimes go for surgery. But the percentage of the patients who are treated with surgery is much less than it used to be. And everything has shifted more or less to systemic therapies, so medical therapies. And there we have, let's say, 3 different types. We have chemotherapy, we have tyrosine kinase inhibitors, such as sorafenib or pazopanib, and most recently we have these gamma secretase inhibitors, which I already mentioned at the introduction, and nirogacestat is the one which is already approved now. It is a bit weird because we are treating a localized disease with systemic therapies, but this is actually the paradigm shift.
Okay. And so I just want to go back to when you were saying something about it may regress. So what does that mean for those on the call right now that may not understand that? What does that mean?
So there are actually cases where we have a spontaneous regression. That means a spontaneous shrinkage of the tumor, and we do not do anything about that. So it is just within time that there is a shrinkage of the tumor, and these patients, you of course do not need any kind of treatment. And this is in the literature. It is written that this is up to, let's say, around 20% of the patients.
Is there like a specific area where you normally see is it like on the limbs? Is it on the torso? Where do you normally see that, or is it just like sporadic?
It's sporadic. So you cannot really, there is not just one location where you see more spontaneous regressions. This is something which you can actually see in all the different desmoid tumors in different locations.
Okay, that's very interesting. All right, for our last question, you kind of hit on this a little bit already, but are there any emotional or psychological challenges related to this condition, such as anxiety, depression, or concerns with body image that you've seen?
For sure. I mean, the important thing about this disease is this is a disease in a very young patient population, 30 to 35 years, with a clear female predominance. We have about a 2/3 female predominance, and so it is. And these patients are affected by this disease often for a long period of time. So it is a kind of chronic disease affecting a very young patient population. And the desmoid tumor can have a major impact on the patient's life, on their social interaction, the ability to work and the relationship. But I'm sure we will hear more about that when we hear the patient perspective. So it is very important to really offer these patients an interdisciplinary care, and we should include all the disciplines which are necessary here: pain specialists, physiotherapists, psychologists, and social workers. This is very important to really help and support this young patient population.
Yeah. So you're saying it's more seen in women. I didn't know that either. And it's a pretty young disease as well. So that's really interesting. Gosh, it just seems like, especially since you don't know if could potentially get this, or it's something that kind of like lasts forever. So I'm really happy to hear that there are some treatment options that are kind of available to alleviate these issues.
Yes, there are definitely a couple of treatment options, especially with the new systemic therapies, and we are of course very happy that we now have the first approved drug for this disease indication. Meanwhile, it's only approved in the US. For about more or less exactly 1 year now. It was approved in November last year by the FDA. And it's not yet approved in my country and in Europe, so we are still waiting for it. But in the FDA, it's already approved and used, and with a lot of success.
That's awesome. That's great to hear. I love to hear progress, especially when it comes to oncology. So thank you, Dr. Kasper, for your insight overview. And as promised, we're going to jump right into our patient perspective from desmoid tumors. So next slide, please. Yes, thank you. So we believe that emphasizing patient voices and amplifying their stories improves patient outcomes, enhances caregiver support, and also advances healthcare professional understanding from the patient perspective. Today we have here joined with us is Brad, who will share his perspective as a desmoid tumor patient, which I'm really also very excited to hear about. Brad, like we did with Dr. Kasper, we would love to hear a little bit more about you before we jump into our discussion. So maybe a little bit where you're from, what you do, just a little bit about you. You're on mute still.
Sorry about that. So my name is Brad Flora. Thank you for having me first off. I'm from Ohio, currently reside in Ohio, have a wife and 2 kids, one in college, one in high school. I am a fire marshal for a fire department. I've been in the fire service since basically I graduated from high school. I've had my desmoid tumor diagnosed since I was like 28, and I'm 43 now. So that's a little bit about me. If there's anything else, please ask.
Oh, yeah. Yes, definitely going to jump right into it. Okay. Can you describe your initial emotions and thought when you first received your desmoid diagnosis back in your 20s?
So I'll give a little background. I am a FAP patient. So I ended up having a total colectomy at 25. After that, I didn't know. I pretty much figured if I had my colon removed, life was good, move on. Well, I had a routine fire department physical that they caught some stuff they didn't like. They ended up finding the desmoid tumor. And right away, it was just a shock because it's so rare, especially having FAP and a desmoid tumor and being a male. It was just like, why did this happen? I had a lot of great family support, great support from my coworkers. It was just all around, but it was still rare. and it's still rare now. And the big thing it was, you're thinking, why me? Why now? Had at that time we had our first daughter, and then just had our second daughter. So I have two young kids, and thinking, what's this going to do to my life? Am I going to be a firefighter again? Am I going to make it to watch any of my kids graduate? That was
Yeah. And where did you where's your desmoid tumor at?
I have a intra-abdominal around my mesenteric artery.
Mm.
So the
Big
bad part
words.
about that, and I know we'll talk about it later, is I went to the best surgeon in America with desmoid tumors, and he's like, I can get 95% of it. But the 5% wrapped around your mesenteric artery, it's not worth it. It will make your life miserable. Let's control it other ways.
Okay, so when you got the diagnosis, you're kind of questioning why me. You just had your children, your two daughters. They're pretty young. Where did you find the strength or your support with these types of challenges that now come along with being a 20-year-old or older 20-year-old, navigating life? You're a new parent. How did you find the strength and support to kind of push along with those challenges?
Don't get me wrong. Right away, it was why me, why this, pity parties, feel bad for yourself. But when I had my surgery for my FAP, I had a lady that was walking around the hall, and I'm slowly moping around, and she's like, "What's your problem?" Not in a fun way. And I'm like, "Well, I got this. I lost my colon, and da da da." And I go, "What's wrong with you?" She goes, "Stage 4 breast cancer." And I go, how do you have the attitude you do? You're just like peppy and awesome. She goes, because it's all perspective. She goes, attitude goes a long way. And I've seen that. When I have bad days, my tumor hurts more. When I have good days, I don't have the pain. And the positive attitude. I've seen too many people within the desmoid community that when they lose their fight, their will, their let's go, they lose a lot more than that, and they end up passing away. So I try to make every day the best day that I can. And my wife, the support there, my brothers and sisters in the fire service, I mean, they didn't take it easy on me, but they also knew, they said, we're there for you, but listen, you're part of us. You got to be strong. And I think a lot of it is, and then meeting other desmoid tumor patients finally. When I finally found that the groups that I could meet other people like me, I realized life's going to be pretty good.
And when you say other patients like you, what does that mean exactly?
So I never met a desmoid tumor patient until after I went to get I was on I was on the standard care back then, which was like some different meds, then oral chemo, and the tumor kept growing. And then finally I found the DTRF, and DTRF, one of the co-founders recommended me go to New York. And then I went to their symposium, and I met 40, 50 people that had desmoid tumors of different places, arms, this. We were all, and here's one thing I will say, because I'll forget about it later. When you've met one desmoid tumor patient, you've met one desmoid tumor patient. We're all different. We're not, it's different things that work for me that don't work for my friends. So when I met them, I have a core group now that I talk to when I have bad days. If I have a rough day or they have a rough day, we go over stuff, and we can talk because we have the same type of symptoms. Nobody knows our journey except for ones that have desmoid tumors.
And so how did that sense of community with your desmoid tumor community, how did that play a role in staying positive in your different strategies during this journey of yours up until now?
It's huge. It's huge because you have your family. But I'm also one that I know my wife as a caregiver is an absolute saint. She's put up with me just being some days the biggest butthole alive. I'll just be honest. Like, I'm having a bad day. And now I can reach out to, before I even like have the bad day, if I'm starting to feel bad or even mentally, like, man, why? And I get into a rut, I can call one of them up. We can talk, we can vent, we can laugh, and then you move on, because
Mhm.
it's that whole thing of, don't let 5 minutes of your day, 2 minutes of your day, one thought in your day ruin the 24 hours in your day.
That is so true. I wish I could like really grasp on that to that concept. Sometimes I have a bad day and it kind of just ruins the whole day because you're just
I do
thinking
too.
about stuff and what's happening and you gotta learn how to turn that off.
Absolutely, it snowballs. If you
Mhm.
don't get out of it, it snowballs bigger and bigger. And that's if if something starts out and I don't get it under control, I'm with you. I just ruin my whole day.
Mhm.
The mental aspect of the desmoid tumor is bigger than people think. Like, then mentally, whether it's a tumor or whatever, I ruin the whole day for everybody. And I look back
Mhm.
and go, man, I let that one thought of why me. And sometimes when I see a friend suffering, that then I go, man, I feel bad for them. And then it snowballs. Or if I'm
Mhm.
having a bad day, and that's why the support system's nice, that you can call someone up, that you can go, hey, I'm having a rough day. And vice versa. They can call and say, hey, I just had a rough
Mhm.
day. Sometimes it's nothing to do with the tumor, but you still have a good support system.
Right. And so this is kind of off script, but Dr. Casper, have you seen anything with your patients if they have like a better attitude or a different perspective that's more positive? Do you feel like that plays a role in their therapy at all? Do they respond better or are they more pleasant to be around? What does that look like when you have a nice, positive, optimistic patient?
I think this is a very general thing. If I have a positive and optimistic patient, and this is not only the case for desmoids, it is always better and always helps in dealing with a patient, and I think it also helps in the success of the treatment and or regarding the success of the treatment. But what I really want to emphasize here, and I think desmoid tumors is a very nice example for that the patient perspective is so important. And you maybe know that we have put together guidelines for this disease, and we have started a kind of consensus initiative in putting together these guidelines already 10 years ago in 2014. And this is an initiative which is meanwhile worldwide organized, and we have a lot of patients and patient advocates within this group. And the group is called the Desmoid Tumor Working Group. And because the perspective of the patient is so important to for this kind of initiative. And yeah, that's something I really want to emphasize here because it really makes a difference.
Yeah, I agree as well. So I'm a Ewing sarcoma survivor, and having a positive perspective, definitely something that changed the entire trajectory, like the landscape of the oncology and the experience that I was going to. It actually made things like more manageable. And instead of looking at my diagnosis or what was going on with me as like something negative, I just said, okay, I can turn this into something positive. And how can I do that? So that's what I really started kind of focusing on. Brad, I'm kind of wondering if you've done the same approach now that you're a little bit older. Like, what are the different strategies that you've learned from the past that you are now implementing in the future?
Well, some of it's just mental attitude, perseverance, um, and some of it's seeing fellow desmoid tumor patients just doing stuff that truly they were told they were never going to do again.
Mm-hmm.
I was told I might not be a firefighter. I might have to retire. I've seen friends that have been told, "Oh, you can't do that. You should just apply for disability." And they persevere through it, and they go, "No, watch this." And I
Mm-hmm.
look at and being older too. 25-year-old me versus 43-year-old me is totally different.
Mm-hmm.
And it's a
Yeah.
lot of it's mental attitude. It's watching, it's learning, and it's setting a good example. It's like, since I've had my desmoid tumor, I've had so many wins. Getting my
Mm-hmm.
bachelor's, getting my master's, truly things that I didn't see on the horizon at 25. So when I have a bad day, I look back and go, you've accomplished a lot. And you have two daughters that are, you try to be a good example and make your daughters or your kids or somebody better than you, because they look at you and go, okay, I can do it.
Mm-hmm. I would love to dive a little bit more into the children-like aspect or the family dynamic. How does this affect the family, your caregiver, your children? Like, what is their understanding of it? Does this affect them at all? I would love to hear a little bit more about that perspective from Brad and Dr. Kasper.
So for me, it does. I didn't realize until I took care of my mom and my dad that, my mom since has passed. But when I was a caregiver, I didn't realize at 25 how much my wife was doing. You don't see it, and how much your kids. We never hid it from our kids. They were young, but we didn't hide the chemotherapy. We didn't hide going to the doctor. Sometimes they would go and sit with me because we didn't want them, if this tumor become really aggressive and we couldn't keep it stable, to not understand what happened. And I know some people's different, but my thing was keep it out front and honest. And I'll tell you, there's days that my wife should have just knocked me out because of the way I was acting. Because back then you just felt bad for yourself or whatever. And to truly see, my family has been my biggest supporter. And if I didn't have them, and now looking back and seeing what all they've put up with, doctor's appointments every month and all this, and I know people that don't have that, and that's why there's a couple groups that I follow that's their family, and we're all a big family. Anybody that has a desmoid tumor, I will talk to at whatever time, because some people don't have the support I had, and I was blessed.
And Dr. Kasper, do you feel like honesty is the best policy when going through something like this as well with the family?
Yeah, for sure. I mean, let's say the good thing about desmoid tumors is that survival of these patients is usually unaffected. And this is the problem, quality of life is. So, and it is a disease which can actually affect the patient for a long period of time, for years. And I mean, Brett is a pretty good example for that. And that's the problem about this disease. And what you really have to improve is the quality of life of the patient, the mobility, the functioning, and so on. And but it's usually not a life-threatening disease. But yes, I think you always have at least from my experience and in my career, I always think honesty and speaking about the problems is the best way to go. It usually helps, and it's in my opinion, it's the best way to deal with the patients, and also within the family.
That sounds totally makes a lot of sense. So last question for you, Brad. What resources, such as support groups or websites, have been particularly helpful for your journey with Desmoid?
So some of my top few is the DTRF, Desmoid Tumor Research Foundation. That I wouldn't have the quality of life I had if I would have waited much longer with the way the tumor was going. And they were huge. The Desmoidian on Facebook. It's truly a group that has people from all around the country. And someday, like, there's certain things that I look for. And if somebody's got a mesenteric desmoid, I'll hop in and talk. I'll talk about anything, but I really try to focus on what I have. Springworks Therapeutics was huge. Their desmoid tumor page on the internet is truly one of the most up to date with. They've talked to patients, they understand it, and then a lot of it is even just mental health in general, not desmoid tumor related, but understanding your mental health and your mental wellness is truly a lifesaver in any aspect, but especially with me with the desmoid tumor and the FAP. I need to make sure my mental health's good. I need to make sure I am dialed in, because when I come to work, when I'm home with my family, if I'm not dialed in, I'm not doing anyone any good. So, I mean, those are some of I have many resources. I got friends, and I actually believe one of them might be on this, that truly I can get a hold of, and she's a rock star. Meaning, that's the other thing. When you get to these support websites and support groups, you meet people and you network. Networking in the desmoid tumor community is the best thing, because you'll meet people that understand.
Awesome. And last question for you, Dr. Kasper. How important is it to have quality of life? What does that mean? And how can oncologists ensure that patients are getting a good quality of life?
Yeah, I mean, the problem is that often the desmoid tumors affect quality of life of the patients in terms of mobility, in terms of disfigurement, or things like that. And when we tested this new drug, which is now approved, what we did in the clinical study is we looked at a lot of these parameters. So what we captured a lot of, we call that patient-reported outcomes. So these are questions to the patients, and we clearly found that with the help of this drug, the quality of life of these patients, the role functioning, the mobility, everything was improved. And that was very consistent with all the different methods and all the different questionnaires at the end we used. And and I think this is maybe the most important thing about this treatment, that it really helps to improve the quality of life and to improve the well-being of the patient. And yeah, even if of course we do have some side effects, but I mean, this is always the problem when you have a drug. But I think if you have a good balance between this, then it's the way to go.
Mm-hmm. Yes, it is. Absolutely. All right, so that concludes our Q&A, or our discussion with the patient and KOL. So first, I want to thank you both again for joining us today and sharing your experiences, your expertise on desmoid tumors. I know I've learned a lot in this little bit of time right now for this webinar, both from a medical standpoint and from a patient perspective. So we want to jump into our wrap-up slide. So next slide, please. Thank you. So today we discussed the perspectives from the KOL and the patient. Our KOL provided insight on clinical presentations, the diagnosis, the treatment for desmoid tumors, while our patients shared their personal journey and coping strategies and many more. This is a very dual perspective that's enriched our understanding of the challenges and support system essential for managing this type of disease. So we're going to jump now into our Q&A. So next slide, please. So if we have any questions from the audience, or if there's anything that maybe you want to share that we didn't capture, I guess this is a really good time for us to kind of capture all of that. So if there's any questions from the audience or comments, concerns about anything, just drop them in, let us know. So we can, is there anything you want to discuss that we may have not talked on, Brad or Dr. Kasper?
Yeah, I'm going to add, and Dana's on here, and if you look in the chat, she's talking about the new nonprofit that her and a couple other awesome patients have done. It's a desmoid tumor, or the desmoidproject.org. They have a lot of stuff dealing with mental health, with dealing with the desmoid tumor. And that's the one that I'm sorry, Dana, I drew a blank. But they started it last year, and truly it's a game changer from everybody that I've talked to that's participated.
Oh, awesome. So is it more focused on mental health, or has other types of coping?
They do a couple outing retreats. They get away, they get out in Dana's, I'll say Dana's wheelhouse, out in nature, and they truly focus on their self, that person, everybody around them. And she would be able to, let her talk, because she's going to be able to knock it out of the park. So if Dana could talk, she's going to be able to catch us all up.
Okay. Are we able to unmute Dana Ann at all? You want to expand a little bit more? Hi,
Hopefully,
Dana.
hi. Hopefully everyone can hear me. Thank you so much, everyone, for putting this together.
Awesome.
It's so great to see resources like this for the Desmoid community. And Dr. Kasper, it's nice to see you again. We've been doing some work in the background on the plain language summary paper. So good to see you. And
Hi.
I just want to share that the Desmoid project, as Brad shared, yes, we are a little over a year old. We started, this is a nonprofit that was started for patients by patients. We are really focused in the mental health space and providing advocacy for the journey that desmoid tumor patients have to experience. We are very focused on education, providing education about what this does to our mental health, kind of how we were just discussing earlier about the tie-in directly between mental health and well-being and your physical health and well-being. And so we really are focused on that portion of it, kind of filling the gap of where we are, in the sense of we've really, as desmoid tumor patients, received a tremendous amount of support in the clinical area and also in the medical arena, but we also need to address our mental health challenges that come along with this diagnosis. So we provide in-person retreats. We are hosting 2 in-person retreats coming up next year, one in March, one in July. And as Brad was saying, yes, we bring folks out to Washington State. Connecting with nature is a really amazing way to help regulate the nervous system and to help provide perspective on where we're at. We also incorporate body work, breath work. We build out resiliency tools, build community, decrease isolation, and provide education about the fact that this is truly a traumatic experience and how to navigate life, discover post-traumatic growth, and learn how to thrive with our diagnosis. That's kind of the focus of all of the work that we do. So whether it comes in through an in-person retreat, we're also going to be hosting 6 different support groups next year. 4 of them focused for patients, 1 of them for caregivers, 1 of them for moms who are moms that have this desmoid tumor diagnosis that have to navigate this journey, and many, many other resources that we'll be dialing out, including our brand new website. So lots of things to offer to our community. And we're just really grateful to be here and to complement all of the other services that are already being provided for us.
Awesome. Thank you so much for that detailed overview. I think it's really important that we come together, we share the resources, the things that are available, because we're all in this fight together, and you can't get through this alone. So this is really awesome that you have created this or running this organization. Are you running it or you created it? Okay, that you created. You are the founder. So it's been amazing. So we are definitely happy to chat about that. So thank you so much, Dana.
Yep. And I have to just include Ashley Williams. She's the co-founder, co-creator of this. And she's our licensed clinical social worker that runs all of our mental health services and programs. So I'm not by myself. There's a couple of us in the background. But yes, and thanks, Brad, again, for seeing that in the chat and for bringing this to this space, because we're really excited to be able to supplement the care for our community.
We love it. Thank you. And is there anything else from you, Dr. Kasper, that you want to share that we may have left out before we wrap up? I believe we have about a minute left.
No, thanks. I'm fine. I'm always encouraged that there are so many initiatives out there, and especially, I mean, Brett mentioned the DTRF, the Desmoid Tumor Research Foundation, which is definitely a very good source of information. They have been organizing meetings every year, and I've been attending them for, I think, almost 10 years now. So this is, and they also, of course, support research. So this is definitely a good source to go to.
Oh, amazing. I'm so happy
in the US.
I love it. All right. So thank you, everyone. We are at time exactly. We did an amazing job. We got exactly to 12:45. So again, thank you all for attending, for being our guests here today, for sharing your patient perspective, your educational expertise. It is definitely appreciated, and it's going to go a very long way in the desmoid tumor community. Again, as I was saying very early on in this talk, This is recorded, so if you want to watch this later on, it's going to be on our Sarcoma Alliance social media pages, specifically the YouTube channel. Have a lovely day, and we are looking forward to the next event. Thank you all. Bye.